In this video, we are going to discuss about the best news for people who are suffering from fatty liver. And that just came out today. Hello, everyone. I'm Dr. Mia, straight from the Gut channel at Gut Talk. Today, we are going to discuss the best news we have been waiting for a long time about the treatment of fatty liver. First, a little background on fatty liver. As opposed to popular belief, as you know, we do not know in science still exactly what is the cause of fatty liver. However, there are certain associations. Remember, these are not cause, these are associations. For example, genetic factor, diabetes, overweight, and some cholesterol disorders or lipid disorders. However, we do not yet actually know the cause. As a result, there is no FDA-approved treatment for fatty liver yet. Do not believe all the false prophet in the YouTube, internet, all of these supplements. None of them have been, unfortunately, proven to be beneficial in fatty liver, or none of them have been tested yet, not rigorously tested. And that's where the good news comes out today from a pharmaceutical company called Madrigal Pharmaceutical Company based in United States. The name of the medicine is resmetirom. What it is, it works on the thyroid receptors located in the liver, not in the thyroid gland, but there are thyroid receptors of beta version in human liver, and this medicine works right there. What they have done is a reliable study, just like the study that scientifically proves if something is working or not. They had around 950 patients. They have done serial liver biopsy over a 52-week period to show the benefit, and it is a double-blind study, meaning the physicians do not know what they are prescribing, as well as the patients do not know what they are receiving. So some patients or half of the patient receive the real pill, another half of the patients, they just received a dummy pill, because this is the only way you can prove scientifically if something is working or not. These are called blinded study. So you are taking out the physician bias as well as the patient's bias. Otherwise, as you know, our human mind is always biased. If as a physician I prescribe something to someone, I feel like, aha, my medicine is helping him or she a great deal. On the other hand, patients also feel that, whoa, my doctor is treating me, so I must be getting better. That is called placebo effect. It is like you take a glass of water to the priest and the priest says, well, I'm going to say a prayer, and after drinking the water, you feel better. That is called placebo effect. That is not a scientific effect. Scientifically, it has to be a blinded study. So we are taking out the bias of the physician as well as the patient to really see whether this medicine is working or not. And that is the standard FDA or Food and Drug Administration uses. I must add that in addition to this medicine, there are several other diabetic medications. They are in line. I'm hoping more drugs will get approved by FDA soon. Some of them are used both for diabetes as well as for weight reduction, both of them combined. In fact, some experts in liver believe that now weight reduction should be one of the target point to improve the liver health. It has been shown that if somebody loses weight, also their liver progression or liver disease progression slows down. So I'm hoping in addition to this medicine that we have discussed about today, there will be other medications in line. Once there is a breakthrough, generally several other competitive medicines will come down. However, at the end, I would still like to add that non-alcoholic fatty liver disease is not a single disease or doesn't have a single cause. As they say, life is complicated. We have to keep that in mind. So probably there will be various strategies and various choices of treatment, but I'm really hoping that there would be soon a breakthrough and we can finally help these patients. But once again, I finish this talk by warning you, do not be swayed by all of this advertisement of different products or this doctor or that doctor Remember, there is no proven treatment yet, unfortunately, other than the general things that we do, like better control of diabetes, weight loss, give up alcohol, do not take any liver toxic medications, and other general health improvement. If you pull the ear, the head will come with that. That's the strategy for now. And eat a good, well-balanced diet. We do need everything, little bit of everything. Excess of anything is bad. So do not get swayed by the other prophets who says, you take this vitamin and your liver will get better. You take this diet, your liver will get better. Please, life is not that simple. Do not be falling into the trap of the people who are trying to make money out of your disease. But good treatment is coming out. We just have to be patient about that. It will soon come out. Again, folks, at the end, I have a special request for you. If you think this talk and these educational materials that I circulate in my YouTube channel, and if you ever benefit from there, would you please help me by hitting the like button and by subscribing to it? And this will help me greatly in bringing you more true information without advertisement, so you know the true fact, not just the gimmick. True medicine, true science. Have a great day and enjoy great health. And by the way, if you had liked this talk, you may benefit from my previous talk right there, which is on fatty liver, a real discussion, real live discussion with my patient about the causes, about how to handle. You may benefit. In addition to that, I have talked about constipation and other gastrointestinal health issues. Please check out my channel. Thank you.